Hi all, I'm Dr. Gayatri, Specialist Pulmonologist at Sai Ganesh Medical Center, Rola. Today we are going to discuss about one of the most common respiratory symptoms, about the cough. The cough that we experience most frequently is associated with fever, throat pain, and that is how it starts. It starts with an infection, a viral infection. It settles most of the time within a week or so. But the problem is when this kind of cough which is there for more than 2 months, then that becomes a chronic cough. We really need to evaluate what is the reason for the chronic cough. And in our clinical practice, there are few common conditions which are the reasons for the chronic cough. About the chronic cough, the most common symptom that we see in our clinical practice is postnasal drip, which is the cough which is originating from your upper respiratory tract. It starts with chronic sinusitis, or it could be allergies. So those are the most, every time the patient coughs with constantly, they will be clearing the throat. So this is because they have some secretions which is keeping on trickling from the upper respiratory tract and hitting their throat, so they constantly clear the throat. So this is one of the most common symptom for the cough which is lasting for months. So this is most commonly because of the allergies. So that is one of the most common reason for this. And the next common symptom is acidity or gastritis. So if acidity can present simply as a chronic cough, especially the night coughs that we experience is because of this acidity or gastritis associated cough. And we always presume that asthma is a disease which will present with breathlessness and some kind of wheezy sound which comes from your lower respiratory tract, but that's not always. And asthma can simply present as cough alone, a chronic cough which is lasting for months, which will not get any better with all your medications. So a chronic cough, most other reason could be cough variant asthma, not the routine, not the other type of asthma which commonly presents with wheeze and all that. So this kind of asthma can simply present as cough. So these are the few common conditions which is presenting for chronic cough. Other than this, there are a lot of other conditions which can present with chronic cough. So especially when you have a cough with blood in your phlegm, or the cough which is associated with breathlessness, all this thing you have to thoroughly evaluate. As we had now seen postnasal drip associated cough, the other cough that we associated with gastritis, and all these are originating from different sites in your body. Seek the help of the specialist to understand more and treat it the right way, because the etiology for each one of the cough, the cause for each one of it is totally different. So the treatment approach will be totally different for all these conditions. So we have to thoroughly evaluate for this kind of chronic cough which is lasting for months.